All right, I want to thank everyone for tuning in to the first ever episode of the Guest List podcast. My name is Jake Gallen, and I will be your host. I apologize if there's no intro music, as I've kind of put this podcast together with popsicle sticks and gum. But I felt like there was the necessity to fast track this podcast because, in light of the global pandemic, there's a need for information and misinformation out there. And my first guest on the podcast is somebody that I thought would be able to bring this information into light. She's been fighting the virus firsthand with all of her medical coworkers at one of the local hospitals. Mine and her friendship goes back quite a few years to our college days at UNLV. She's a very intelligent woman, very vibrant, and full of energy. She graduated from UNLV with a bachelor's in nursing. And I want to introduce my friend Bobbi Tibbits.
Hi! That was a very nice introduction. I appreciate that.
You know, I actually paused a little bit. I was a little nervous. This is my first time doing this, but I'm so glad that you accepted my invitation to come on here.
Yeah, thank you for inviting me. This is spreading correct information is what I've been doing kind of since this started. So I'm excited to be able to have the opportunity to do it on a larger platform.
Thank you. Before we start, how's your quarantine been?
It hasn't really felt like a quarantine because I'm still going to work at the hospital. But I think that we've been doing well, trying to do little projects around the house and just doing stuff to keep us busy so we don't tear our hair out, you know. It's boring.
Yeah, I feel the same way. I posted on Twitter a few weeks ago that everyone that comes back from quarantine is going to be either really fat or really skinny from doing YouTube home workouts all day, which is kind of what I've been doing. And we all miss the gym very much.
Yeah.
Morale's high, and how's the morale at the hospital that you've been working at?
So I think the stuff's been going on for about a month. I think the first week was really, really hard for us. We got especially hit harder with some like outside stuff that wasn't corona related on top of the corona stuff. So the first week was pretty rough, but by the second week, we had so many people in the community like going out of their way to personally thank us and bring like just coffee in and stuff like that, and it really kind of helped rally everybody. And I feel like I've worked there for a little over a year now, and I feel like now we're starting to work more like a team and feel more like a team than we ever have. And I think it's mainly because of how much support we're getting from everybody else in the community.
Yeah, even, you know, when you're new somewhere, you can usually recognize if something's really out of place or really different. And I think the coronavirus has just taken everyone by storm. No one was really prepared. We heard out of China that there is this disease, and then all of a sudden it kind of just blindsided everybody. Was there ever like an oh shit moment, or when you guys realized at the hospital that this was not something out of the ordinary?
We had all been talking about it, and I think our oh shit moment was the moment that we ran out of N95 masks. We ran out, and we only ran out for an hour. Like we hit this point where our managers started telling people that we don't have any more, and they actually started crying. And then an hour later, our CNO said, "Oh my God, we just got a surprise shipment. We didn't know that it was coming." And they were a whole new set of N95s. So I think that I don't know if as a collective unit we've had an oh shit moment where we're going, oh wow, like this is bad, but I feel like in the ER we're really good at rolling with the punches. It's more of the like that kind of stuff that's really been hitting us hard, is the not being able to get protection.
Yeah, that's something that's constantly what you see in the news is PPE and the low supply. You guys are supplied now?
As of right now, we have enough. We've got supplies. We're reusing them according to CDC guidelines and stuff like that. So we're able to mostly stay protected. But of course, all of the stuff that we're reusing was never meant to be reused in the first place. So you kind of have that at the back of your mind while you're wearing a mask that you wore 2 days already. So
That's very stressful.
yeah, it's better than nothing though. I'll give it that.
Yeah, I saw C-Slack more specifically. He was on I think it was MSNBC a week ago, and he was talking about how the governors are kind of been forced to bid against each other for PPE, and just like a terrible situation altogether. But I have seen people within our community donating a lot as well. Have you seen a huge reception from the community?
Yeah, actually I have personal friends. I have people that I've never met before that have reached out to me, and they're saying, "Hey, I just started sewing because I have nothing to do during quarantine. I taught myself how to sew and I made these masks. Do you want to take them?" We had, I think someone said, like, this cute little old lady reached out to us. She's like, "I found 5 N95 masks like at the bottom of a box in my garage. Do you want them?" And we were like, yes, we do. So the amount of donations for like cloth masks and stuff like that has been awesome. And we received a lot of donations for gloves, but I personally haven't seen a lot for N95. And that's probably the most important thing that we need.
Yeah, I actually saw some people getting pretty creative and 3D printing N95 masks. So I know everyone's trying to help out in any way possible.
Yeah, I've seen that as well. I've talked to one person that we were like going back and forth about it, but I'm not quite sure how that works because I know it has to be kind of plastic and the material is different, but I've definitely seen that too, and it's awesome.
And then the other concern that I've seen on the news was regarding ventilators. How are you guys in that area?
So thankfully we have enough ventilators at my hospital, and I have not heard, like rumor wise, that we have had a problem in Las Vegas as of right now. There is a website that's name I cannot remember. I'll have to look it up, but it has statistics on there for how many ventilators are needed versus how many that we have in the state, and how many are it says how many are needed, not how many we have in the state. So based off of that number, I'm seeing the number and I'm like, oh, I'm pretty sure we've got enough for that right now. And then also based off of that website, it'll show like ICU beds that we have, and that we're like, if we have too many patients versus not enough beds and stuff like that, it shows that kind of info.
And ventilators, sorry, cut you off. Ventilators are strictly for patients who are in serious condition?
Yeah, and they can be for any patient that's in a serious condition, not necessarily a COVID patient.
Okay. Have you guys ever reached a point of capacity or neared it? I know that was a big take, was that they felt a lot of the health industry was going to hit a surge. And then we've seen in some other countries where they have to make the unfortunate decision of kind of playing God and picking who receives priority over others. Have you guys ever neared that capacity?
Yeah, so thank God we have not had to do that yet. The only thing that I've heard has really reached capacity would be our ICU, and I'm only speaking for my hospital.
Mm-hmm.
And with that, the ICU is usually the place where most ventilated patients go. So, and that's where our most critical patients go. So if we're seeing that, then we're mostly only seeing really, really critical patients, but we haven't had to pick and choose. And I think that my personal opinion is that I think we owe a lot of that to shutting down the city as soon as we did, because I don't think that the larger, like the casinos, would have gone out of their way to do that. Tourism is their money, so it makes sense. But the fact that we shut down so early, we haven't had to pick and choose people like that, and we haven't seen that dangerous level yet. Well, yeah. I don't want to say yet, but I also don't. I hope we don't see that. That's what I should say.
Yeah, I applaud our government officials for taking serious action in the beginning and being one of the first states to close essential businesses. I think that was almost a month now.
Yeah.
even extending the stay-at-home orders, because there's still a lot of uncertainty surrounding it and the spread. Even on the Strip, there's huge influx, and you're kind of just stuck when you're an employee on the Strip. You're forced to just like take it because you're greeting guests, or people are gambling, and people are just sharing any kind of surface and touching and swapping germs.
Exactly. It would have been a germ hub.
Yeah, it's a pain. What are there any moments during this virus pandemic that sticks out to you in the hospital, as far as like guests that are coming in or anything of that nature?
Um, Besides, I've noticed two things. One would be that we have to ventilate, or I heard this number from a coworker. I don't know if it's an actual statistic, so don't quote me on it. But someone told me that we were intubating about 2 to 3 patients a day. And usually, at least in the ER, it ranged from anywhere like from 0 to 3, like before everything that's happened, 0 to 3-ish patients a day. And that would be because of any reason, someone would come in and they're not breathing, or no one would come in. It would be a good day or a bad day, whereas every day is like a bad day, a 2 to 3 patient day. So that's something that we're seeing a lot more of, is that we're ventilating. And then I'll also say that I'm seeing a lot of anxiety. A lot of people are coming in for anxiety, and they'll say, oh, I have chest pain, or I feel like I can't breathe. And it's because they're having so much anxiety about the coronavirus and about what's going on. And usually I find that those same patients are less informed, and that's possibly why they're having their anxiety. But those two things is what is standing out to me, or what I'm seeing the most of right now.
And so when somebody comes in with an anxiety or something that's not necessarily a COVID serious patient, are they given priority, or COVID patients given priority to a bed, or are they kind of just sat there and they take up a bed when it could be used for somebody more serious?
Um, so the amount of people that we're having right now, at least that I'm seeing, is that we have enough beds for anybody, and we're not turning people away. We can't turn people away, even over the phones. Um, but if someone comes in with anxiety and stuff, and they have those like chest pains and or shortness of breath, or they're like the panicking shortness of breath, and not necessarily I'm coughing and COVID shortness of breath. Unfortunately, those symptoms are very similar to the symptoms that we see with COVID. So they go into a COVID rule out, which means they are risking exposing themselves to COVID-19, which doesn't, I feel like if someone has anxiety or something that's not urgent, don't come to the ER, because then you're not exposing yourself. And that's also what we're seeing from the CDC. Like, don't go unless you can't breathe, you're having all these other things going on. So I worry about those anxiety patients coming and exposing themselves. Not that we don't necessarily have the space for them.
Yeah, that's the risk of social media and the misinformation that's been passing around, is a lot of people end up becoming hypochondriacs, and they're unsure really of what they're feeling, or if they're contagious, or maybe one of their friends was positive and they've been around them and they want to be safe. One thing is, what are common symptoms of patients who come in? I know they have like the upper respiratory infections. I have seen some people say that a loss of smell and taste is like a minor symptom. Are there any like irregular ones that are part of the COVID?
So the things that we're screening for right now is if you have any upper respiratory symptoms at all, including the loss of taste or the loss of smell. And that's basically, if you come into the ER and you have those things, then you'll be ruled out. Whether or not you'll be tested is different, but we still consider it a rule out. That's what we call all those patients, rule out patients.
Okay. And how long are patients, when they're admitted to the ICU, how long are they usually there before they have recovered or are released?
So the unfortunate thing about working in the ER is that I don't really get to see the end of the story. I get to see what comes in and I get to see what goes upstairs or what leaves, but I don't really get to see what happens after that. Right now, I'm hearing from other hospitals in the nation. Um, just a regular hospital, when there's a baby born, the mom is wheeled by this little like button on the wall and she gets to push it, and over the whole hospital it plays like 3 seconds of a lullaby. And what other hospitals are doing is that little button that's on the wall, they'll put another one somewhere else, and the patient that is COVID positive and is going home because they've recovered gets to push that button, and then it'll play over the whole hospital that like we have a win, we're like, we get to tally the win that's in our head. And we don't have that at my hospital right now. So I have absolutely no idea who's going home and surviving, who's not going home and surviving. But I was just actually yesterday bringing up the idea to my ER manager. So maybe hopefully we'll have that soon and I'll have a little bit of a better idea.
Yeah, the small moments of victory is something that we need when, especially in your position, when you're just seeing the high intense situations in the beginning, you kind of have that sense of like worry and curiosity and hope that everyone recovers.
Exactly.
Has there been any big changes to the hospital as far as like your guys' work hours or ramp up in security measures or sanitation methods?
So we have designated floors or designated areas for COVID patients because as of right now, they're considered airborne. So that means if I were to just stand here and talk, like my voice or my germs in my breath, I guess, could carry up to 6 feet. That's why we're saying the 6 feet distance. And it's in the air, it can float around, and especially like in a hospital where there's stagnant air just sitting there, it can really linger. So some of the rooms in my hospital have been converted to reverse isolation, which means it takes the air that's inside the room and pulls it out instead of like pushing it through the hospital. So it's a different like system that way.
Yeah.
And because of that, we've been able to convert a lot more. So we send some patients to this area, some patients to this area. So it's organized a little bit differently. And that's kind of the biggest like layout way with the hospital that's changed.
Interesting. Yeah, I've also heard that in some hospitals, maybe it's not specific to Vegas, that they're ramping up security measures and like if a family member is coming in, they can't see their family member who's been infected, or even if they're at the hospital for a different reason, maybe they broke their leg or some other situation, they're just not letting.
Oh yeah.
In.
There's the only reason why someone or a visitor is allowed is if someone is having a baby or if someone is dying. Like actively right now dying. And usually then you only get about one visitor. I wish, or I hope that we get more security. It's something that we in the ER have needed for a while because nurse to patient assault rates are actually a lot higher than you'd think. But that's just something that we need in general to.
Really, is that out of fear from the patient, or is it because maybe they're in a confused state?
Usually the assault rates usually come from, I'm not saying that they're on the rise from COVID-19. Mm-hmm. I say that they're bad in general, and there's not a lot of laws to protect us. And it's not treated. I feel like it's not treated with a lot of seriousness because I see that it's usually psychiatric patients that'll do that. But even then, like we have drunk patients that'll come in and stuff like that. And I've seen nurses and staff assaulted, and like not a lot comes out of it. And it's a really, really big issue. I think that, I don't know if you've seen it, and it'd be cool if this podcast gets big enough for you to have him on, but Z-Dog MD, I believe he is a physician that still practices here, or at least he started here in Vegas. He's really, really big on healthcare assault workers, and he has a lot more information about it than I do. But ZDoggMD, that's like his Instagram handle, and he has so much valuable information about everything healthcare related, including COVID.
That's definitely something I'll look into. I didn't realize that was an ongoing issue, but now that you pointed out, I could definitely see it as far as physical assault and even sexual harassment too, as well.
Mm-hmm.
And I can see, because of COVID, I think a lot of the world is going to end up changing because of this. So maybe, and hopefully security measures will be one of that ramps up a lot.
Yeah, I really hope a lot of good changes come out of this.
Yeah. One question too, I see a lot of questions, is regarding patients who don't have insurance. Can you shed some light on that? Do you know any information?
So I know that whether or not you have insurance, we're still going to take care of you. And I personally, the way that it works in our hospital is that a completely separate department will come over and get your registration information. So your insurance or no insurance, your ID and stuff like that. But I did read a post today that someone said that he felt like he was treated different as a COVID patient because he didn't have insurance, or he wasn't able to go to like a better hospital. I know that we do not turn away patients that do not have insurance, and I don't treat them any different, because most of the time I don't actually know whether or not they have insurance. It's not something that I look for. I just take care of the patients. But I don't really have anything else. I don't know anything else about any insurance and problems. Unless you mean like testing.
No, I was talking about treatments. I've seen a lot of people just in general are afraid to go to the emergency room because they don't want to get stuck with, tens or hundreds of $1,000s in bills. And you see reports in some of the news saying that people are getting stuck with a $45,000-$50,000 bill because of it. And I know the government has talked about kind of just paying for it through their different stimulus packages, but I haven't heard any experiences from there. So I was just curious on what your opinion of what you've seen.
Oh, unfortunately, I haven't seen the bills or any of the patients that go home with them. I don't know too much about that, so I'm not going to talk about it.
I mean, that's good though, because then you need to focus on your patients.
Exactly.
And so then it comes to the big question. As far as in your opinion and from your health workers, where do you see us on the curve right now? Do you think we're still ascending to the top? We've hit the top, or we're kind of on our way down?
As far as Nevada, or
as far as from your hospital experience, are you seeing more patients every day? It's kind of plateaued, or maybe it's like steadily decreasing?
So based off of some of the things like the website that I mentioned earlier with the ventilators, and based off of what I am seeing in the ER, it's looking as though we have already passed our peak and are now plateauing.
That's good.
But the unfortunate thing about that is that it thinks that we're going to plateau until August. I hope we don't, but I think that I definitely feel as though the peak was like about last week. It was the week before and last week. It was going down a little bit. But I do want to say with that, even though we possibly are hitting a plateau or coming down, that doesn't mean that we should stop quarantining or doing anything like that, because as soon as we come out of quarantine, there's a strong possibility that as soon as everybody is mixing again, we go back up. So what to do as that second peak hits, or like how we're going to come out of quarantine, I have no idea. I have no idea what we're going to do about that.
Yeah, second waves, from the research that I've done, are actually pretty common in virus like pandemics. I know in the Spanish flu 100 years ago, there was actually 3 different peaks. I don't want to fearmonger people who are listening, but people need to be prepared, and especially in one of the entertainment capitals of the world, where you get people from all over. It's hard to even know, but I'm assuming that especially the Strip is going to have a lot of different rule changes because of this. More sanitation, like the gambling tables are going to have less people. And I know they have plan phased opening as far as different sections and have the larger events open last.
That makes sense.
Yeah, so I see, especially also that people are now more aware. We have face masks. And do you know, as far as face masks, even like our cloth face masks seem to be working?
Can you repeat that? Sorry, you cut out a little bit.
As far as face masks go, some people don't have the N95s and are using cloth masks. Do you know if they've been effective at all?
So the point of the general public wearing cloth masks is in the event that they are asymptomatic. So they don't have symptoms and they're a carrier of COVID-19. They wear the mask because it keeps their sick to themselves. Any of that stuff I was talking about earlier, when you're breathing and everything's going into the air all around you, that's not happening, or it's happening a lot less because you have literally something covering your mouth. As far as N95s go, the N95s, you have to be specifically tested for them, for the face, for it to match your face shape and what size to wear. Just for instance, I know that we have, let me think, 1, 2, 3, 4, 5, I think 6 different kinds of N95 masks.
Oh, wow.
At the hospital, just like different brands or different cuts and stuff like that. Unfortunately, only one of them fits me, but it's because it creates this tight airlock seal. It goes like this and then down underneath the chin. And then I don't know if you've seen those pictures and stuff where nurses have like those red lines and bruising and stuff, but I totally look like that by the end. But it's that seal that it creates that's not letting any airborne come into the mask, that's preventing us from getting sick when we're with other patients. So when I'm out at the grocery store and I see these N95 masks and it's this big mask on this little person, I'm like, that's not doing anything. Well, it's not doing anything to protect you, but it's protecting other people from you still, because it's still a mask. So cloth masks, for their intended purpose of not spreading, are going to work. And then the N95s, as long as people, I mean, if you do wear them, if it's been sized to you correctly, I know that in the hospital, obviously we're specifically trained to know how to use them, but it's really hard to say that the public should wear them, or, you know what I mean? Because it's with the testing and everything, and especially if someone has a face like mine, there's only one that's going to fit you. So it's really hard for me to sit here and say that they should use it. It's just, we don't have the supplies or the means to be able to give it to everybody that way. That's why if everybody just covers their mouth with a cloth mask, then you're not spreading to others, and that's got to be the best thing we do.
Yeah, it's, in this situation, it's better to be overprotective than underprotective. And
Yeah.
you know, as a fellow raver, we've been practicing with cloth masks for quite some time now. I had to bust out
Yes.
the other day when going out to the store.
Yep. You get to wear the cool one with all the patterns and the faces, and
yeah, I have a skull one, you know, so
yes,
looking a little scary, but protecting everyone from myself.
yes. You're doing your duty. That's all that matters.
That's funny. Yeah, and also, I have a question. Do you think handshakes survive after this pandemic, or are we gonna have to have a new greeting measure?
I mean, I certainly hope they do. I really, really miss hugging my friends. So I just want to hug people. I don't really care about handshakes, but I think they will. I think that people will learn to trust touching each other again. It might take a little while. I know that some of our ER nurses, not that we're a huge affectionate bunch, but we would greet each other usually with hugs, or if our favorite person came in, but now it's just like elbow bumps and we're not touching each other a whole lot. So it'll probably take a while, but I sincerely hope it comes back.
Yeah, and it's just feeling closeness with somebody, just touching their skin. That's like the part of it. I hope it doesn't, you know, if not, some people are saying the Wakanda salute is going to be the next greeting measure.
All right, you know, I'm really okay with that. It sounds really cool.
That's funny. This has actually been very informative, and I'm glad that you can be my first guest and share any information. Is there anything that maybe I didn't ask you that you'd like to bring up before we close this out?
I think, well, I can answer a question that I hear most in the ER from other people. And the number one thing that I'm hearing is that people are like, well, what do we do if we get it? Like, I know that a lot of people know what to do to make sure that they don't spread it, but what exactly specifically do we do if we do end up getting it? And when do we go to the ER and all that stuff? And I'm going to try to make it as simple and sweet and short as
Yeah.
possible. So, I know that I've heard that a lot of different primary care providers are providing testing. I know that in the ER, at the very least at my hospital, we're only testing the patients that come in that are severe enough that need to be admitted. The CDC is saying to stay home if you have mild symptoms. What does mild symptoms means? You have an upper respiratory infection, you're coughing, and maybe you can't smell or something. But if you feel like you can still breathe, if you have a fever that you can maintain with medications, you're okay to stay home. If that stuff starts to turn, you don't feel like you can breathe, you cannot take care of your fever correctly, if you're feeling weak enough where you can't get up, like if this is getting bad, then please go to an ER. But I know that the CDC is saying if you have milder symptoms, try to stay home and try to just treat your symptoms based off of what you've got, like the cold and flu stuff from like a Walgreens or a pharmacy or something. So just try to make sure that you have a plan. Like, okay, if we do get this, then we have the spare room set up, and then whoever's sick can sleep in the spare room, and we'll make sure to keep that person with a mask on. Like, make sure you have a plan for your household, and then go to the CDC website. It's saying the exact same things that I am, and make yourself a little plan so you don't get anxious and you don't end up in the ER for anxiety.
That's funny. One more. Where's the most common place to get tested? I know UNLV had a site test set up. Do you know if that's still there?
So I just got updated. They ran out of tests like last week, I think, and now they're reopening. It's on a day-to-day basis based on how many tests they have. As of right now, they said that they are still testing. And then I heard from someone else that they contacted their primary care provider, and then the same day, like I think a nurse and a doctor came out in like full hazmat suit,
Oh, wow.
came into her house, like she didn't even have to leave her house, came into her house, swabbed her, and left. She didn't have it. She had something else, which is great. But I would just call your primary care provider, or just keep calling UNLV or Southern Nevada Health District. Those are going to be the best things for you to get tested. And then, of course, those moderate to severe symptoms, the ER.
Wow. Yeah, that's it's good. I know a lot of people, more so younger people, they seem to have like more resistance towards it, and it's just like a slight cough. So I'm glad to hear. Bobbi, where can people follow you if they're interested in following you?
On Instagram, it's at shrimp on the Bobbi, all one word. And then Bobbi is Bobbi. Yes.
Thank you, Bobbi. I appreciate you for being here. And before we go, I just wanted to thank everyone for listening to this first episode of the Guest List. If you want to follow me, myself is at Jake Gallen. The podcast is at the Guest List Pod. And if you want to put somebody on the guest list, or somebody who has information regarding COVID or just anything within the city, interesting personalities, doers, innovators, and everything far and in between, feel free to reach out. And we hope that we can get this platform growing and reach the entire city in no time. So once again, Bobbi, thank you so much for coming on. This has been very, very informative.